MRD or minimal residual disease is now one of the standard tests which we do on all children with leukemia, particularly for acute lymphoblastic leukemia, but increasingly for acute myeloid leukemia as well. So what is it? Essentially, we want to check how well the cancer cells are responding. So in the past, the doctor, the pathologist would look under the microscope and count the number of cells, and if they were 100% abnormal cells before, they would want to see, well, has this improved, and maybe there are only 1% abnormal cells or 2% abnormal cells. Now, there is a limit to what a human eye can count with, and so if you want to find out whether the disease is low after treatment, or the disease is very low after treatment, or the disease is very, very low after treatment, you then need to depend on technology. And essentially, minimal residual disease is a method to determine what is the level of disease after first few weeks of treatment, whether it is very low, very low, very, very low, very, very, very low, and so on. And so for that purpose, we either use molecular markers or we use flow cytometry to ascertain the level of minimal residual disease. And the logic is that if you have good response and your minimal residual disease or MRD is very low or negative, then you can decrease the therapy. On the other hand, if your MRD is positive, then you need extra therapy. It is important to remember that most patients with low MRD will do very well, and most patients with high MRD will also, in today's day and age, do well. So a high MRD does not mean automatically it's bad. It just means that there is extra treatment and extra tests needed. Thank you.